I've been involved in some of these clinical trials since 2005. And what I do remember is perhaps the first few patients that I treated. Because these were very hard for me and also very hard for the patient, because they were going to undergo a procedure which was not yet approved and was very early in the development. So I particularly remember my second patient, who was only 25 years old. And when she came to me, she had read everything and she found out from Google about this procedure. And when I met her, I'd only done one procedure. And so I told her, listen, I don't think this is the right treatment for you. I think you should have traditional surgical repair. And then she said, look, I met the surgeon and he recommended it. And he told me there's a 90% chance of a success. And then 5 to 10% I may have to replace the valve. And then she said, I'm only 25 years old. And if you replace my valve so young, I probably won't be able to get pregnant. So I'd rather you have tried this method, and if this doesn't work, I can have surgery. So I said, why don't you wait for the clinical trial? And she says, what's the clinical trial? I said, the clinical trial is a study where we're going to randomize patients between the clip and open surgical repair. And she said, I don't want to have open surgical repair. She says, what about right now? I said, right now, you're the second patient, so you're a roll-in. And she says, what's a roll-in? I said, a roll-in is an experimental patient. You're like the first guinea pigs of the study. And she said, I want to be a roll-in. Let's go forward, 2021. She now works as an important lawyer in the VA Medical Center. She does Pilates 3 times a week. And she stays eternally grateful for actually doing so well. And as far as I'm concerned, I always tell her, it's okay. If it doesn't work after some time, you can still have open heart surgery because you never had open heart surgery to start with.